So hello again. So now I want to talk about the three core elements of healthcare policy in the United States and everywhere around the globe. We talked about those a little earlier in relation to the tree, thinking of the air, the water, and the soil. And the three parallels in healthcare policy are cost, quality, and access. And let's talk about those three in turn. So cost, you can also refer to that as financing. Basically what we're talking about is the sources and the uses of money to pay for medical care services. There's other money that goes to paying for the cost of administering health insurance and other bureaucracy and other kinds of needs, but understand that overwhelmingly the money that goes into the healthcare system pays for medical care services, the salaries and wages of the people who work in medical care, the costs of administering systems, and all the rest. But so that's what we mean when we say cost. Second term is quality. And by quality, we mean the level of effectiveness and efficiency through which services are provided and whether they actually lead to the outcomes of people getting cured or staying healthy that we want. I have a favorite definition of quality that I like that applies to healthcare and pretty much anywhere. My favorite definition is quality means doing the right thing and doing it right. So there's two essential parts of quality. You want to make sure that you're doing the right thing as opposed to the wrong thing, and you also want to make sure that you're doing that right as opposed to doing it wrong. Sometimes people choose the right thing to do and they do it wrong, and that leads to a poor quality outcome. So there's two pieces to it. The third essential component is known as access. And by access we mean insurance coverage. That's what most people think of when they hear the word access. Actually, insurance coverage is a fundamental part of access, and there's a lot more. The accepted definition of access has 5 terms to it. First one is affordability. That involves health insurance, whether or not people can afford to be able to obtain the services that they need. The second is availability. That means the extent to which a provider has the services, the personnel, the technology to meet people's needs. That's a fundamental point of access. A third one is called accommodation. That means the extent to which the provider is organized to meet the client's preferences and constraints. For example, if you are a disabled person and your provider is unable to provide services to you because of your physical needs, you have a problem of access because of a lack of accommodation. The fourth component of access is called accessibility. So that means, for example, you may have insurance coverage, you may be able to pay for services, but you don't have a provider anywhere near where you live. And so you have a problem with accessibility. And then the final part of access is called acceptability, and that's the extent to which a client is comfortable with the provider. So for example, some people it's very important that you have a provider of the same gender, and if you can't, it makes you uncomfortable. That's an issue of acceptability. And there's different interpretations of how people should respond to that, but it is very much a part of access. So we have a saying in healthcare policy: quality, access, costs. Pick any two. Because normally when you try to do something to lower costs, you're going to have some adverse impacts in terms of quality or access. A lot of times when we try to improve access, it ends up increasing costs. And so normally we're into the uncomfortable zone that economists refer to as trade-offs, where one goal has to be achieved at the cost of another. Sometimes we're able to have health policy improvements that actually end up having a positive impact on all three. I wonder if you can think of any. I'll just give you one example. So for example, essential childhood immunizations. If we get the immunizations that kids need at the time when they need them, so we do it the right way at the right time, we improve quality, we improve access, and we know this, it's been proven, we lower costs when it's done well. So we can refer to that as a health policy home run. Unfortunately, most of the time in healthcare policy, we're confronting these kinds of uncomfortable trade-offs. But I think the important thing to understand is there's no health policy issue that you're going to ever confront that doesn't involve at least one of these dimensions, normally at least two, and more often than you might realize, you're addressing all three at the same time. And so as you look at any healthcare policy problem, you want to examine and understand and think about the implications on cost, quality, and access, and not just look at one or two as opposed to all three.